Good afternoon, good morning, good evening, depending on where you're watching us from. You're tuned in to the Health Live Show. Now, this live show is under the Scale Up PrEP Access campaign, and it is brought to you by the Zambian Youth Platform with support from PEPFAR. Now, on today's live show, I am joined by Msonda, who is PEPFAR Interagency member and USAID Community Art Advisor. Sonda, welcome to the show.
Thanks, Michelle. Good morning, good afternoon, everyone. Welcome to this show.
Okay, so to just get the ball rolling, could you tell us a bit more about yourself, Sonda, so that people can get to know you?
Well, I think I would call myself a sexual rights activist. I think I'm really passionate about ensuring that young people have access to information that will allow them to make informed decisions about preventing pregnancy, preventing STIs, and most importantly, preventing HIV infection. So I love getting out there talking to young people. So it's really an honor for me to be on this webinar with you, talking about something that I'm so passionate about, which is pre-exposure prophylaxis.
Okay, perfect. So like Msonda has said, today's topic is access to PrEP in Zambia. So just to get into the topic, Msonda, what is PrEP for those that might be hearing the word for the first time? Could you explain to us what PrEP is?
Sure. And it's really quite surprising that a lot of people don't know about PrEP because it's been offered as a prevention method in Zambia since 2018. So PrEP stands for pre-exposure prophylaxis. It's an HIV prevention medication in the form of a pill that you take every day. And it's highly effective against HIV prevention, against HIV infection. And if taken correctly and consistency, it can keep the user protected up to 95%.
Okay, perfect. So, would you say that PrEP and PEP are the same?
No, and I think that's where the confusion comes in. So PrEP is pre-exposure prophylaxis. So you take it basically to prevent HIV, so before possible HIV infection. And PEP is post-exposure prophylaxis. So this is often used by people in the medical profession when they have accidental needle pricks, or if somebody has engaged in a sexual encounter with someone whose status they don't know, or who potentially may be infected with HIV, they can take PEP for 60 days to within 72 hours. That is a critical thing to remember, to prevent HIV infection after exposure.
Okay, perfect. So what does PrEP do and what does it not do? So maybe we can start with what PrEP actually does before we get into what it does not do, because we have heard a lot of misconceptions from different people who tell you you can take PrEP for this and you can take PrEP for that. So what does it do and what does it not do?
Okay, so when taken, again, consistently and correctly, so this is every day, so as long as the user does not skip pills, and ideally takes it at the same time every day, PrEP can protect you. It's actually more than 95% effective from contracting HIV. So what does PrEP not do? PrEP will not cure HIV. It will not prevent pregnancy. It also will not prevent other sexual transmitted diseases like gonorrhea, chlamydia, syphilis. And so even while you are taking PrEP, it is recommended that you do use condoms to prevent pregnancy. Or if you are not using condoms for pregnancy protection, then you should be using another contraceptive method of your choice. So it's important to ensure that even while using PrEP, you are still taking the necessary precautions to ensure that you are protected from unwanted pregnancies and also other sexually transmitted infections.
Okay, perfect. So how do I know, for example, if PrEP is the right option for me as an individual? How would I know?
So basically, you have to, I guess, internalize the risk. And so you could say that PrEP is a good option for you. Well, firstly, you have to be HIV negative. So if you're already HIV positive, what you should be doing is taking antiretroviral therapy, which is free at all government facilities and will help you keep healthy. And if you're virally suppressed, you will not pass the infection to anyone else. So if you're HIV negative, but you are concerned about HIV prevention, and you are sexually active with a partner or partners whose HIV status you don't know. If you've potentially had exposure to sexually transmitted infections within the last 6 months, and also if you share any injecting drug equipment. So if you take a look at yourself and you say, okay, these are some of the things that have happened to me within the last 6 months or so, then maybe I should visit a health facility and talk further to a provider to see if PrEP is something that I should begin taking.
Okay, perfect. Thank you. So for those of you that are just joining us on our various platforms, whether you're joining us on YouTube, on Facebook, you're free to leave your comments, your questions in the comment section, and we're happy to actually go through some of those questions. Miranda says, thank you for bringing such an interesting topic. I've been looking forward to learning about PrEP. Thank you so much, Miranda. We're happy that this particular show will be able to answer some of the burning questions that you might have. Yeah. So, Musonda, moving on, how do I take PrEP? How can one take PrEP?
So PrEP is easy to use. So again, you take it every day. It's one pill that you take per day. You can look at your lifestyle and say, okay, maybe mornings are too busy for me, so let me set my alarm for evening. If you are a morning person, then take it in the morning. So you just have to make sure that you pick a time that works well for you and can really fit into anyone's lifestyle. It can be used by women who are taking contraceptives. It can be used by women who are pregnant and or breastfeeding. So it's something that can easily be fit into your lifestyle if you are wanting to protect yourself from HIV infection.
Okay, perfect. So like I mentioned earlier, we will be reading some of the comments and the questions that the viewers have, and hoping to get more of those questions, any burning questions, and any of those comments. So do remember that this live show is under the Scale Up PrEP Access campaign, and it is proudly brought to you by the Zambian Youth Platform with support from PEPFAR and Chaz. So I am joined by Musonda, who is PEPFAR Interagency member, as well as USAID Community Art Advisor. So Miranda Ziva says, who is eligible to access PrEP?
So, hi, Miranda. Thanks for your question. So, who is eligible to access PrEP? So, basically, anyone who is over the age of 16, or if you are under the age of 16, if you are an emancipated adult, if you are engaging in potentially risky sexual behavior, which is you have more than one partner. You have a partner whose HIV status you don't know. What a lot of people also don't know is PrEP is recommended for pregnant and or lactating mothers. Zambia has a lot still, even though a lot of progress has been made in eliminating the transmission of HIV among from mothers to their unborn babies or babies that they are breastfeeding, we're still seeing a lot of these infections. So if you are pregnant and or lactating and you want to prevent yourself from contracting HIV and subsequently giving it on to your baby, you can also access PrEP. So if you feel that you are at higher risk and you just want to learn more information about PrEP, you can visit government clinic anywhere near you and speak to a provider who will help walk you through the process and together determine if PrEP is right for you.
All right, thank you so much for that, Musonda. So what would you say is, if, let's say, for example, a lot of young people have actually talked about how PrEP or PEP is sort of being charged in certain health facilities and things like that. And so a lot of them are sort of very skeptical about going to the health facility to access PrEP. Will I have to pay for PrEP or the services if I go to a clinic or a hospital?
You will not have to pay for PrEP if you go to a clinic or a hospital. PrEP is provided free of charge to any client or individual that wants to access it. So you can go to your nearest health facility, and to get information on what your nearest health facility is, you can take your phone and dial *573#. That'll give you a menu that can also allow you to determine, depending on where your location is, the nearest clinic that is closest to you. So go in. If anyone tells you that you have to pay for the PrEP drugs, or you have to pay for the HIV test, which you need to take before you start taking PrEP, none of that is true. All of these services are provided free of charge through the government of Zambia, Ministry of Health clinics.
All right, thank you for that. So where then can someone go and access PrEP? Where would someone go apart from a health facility? Are there any other designated areas where I would go and access PrEP?
So what we know in Zambia, at least, is that we have higher rates of infection amongst adolescent girls and young women. So these are girls and young women aged between 15 and 24. So because of these higher rates amongst this age group, we are offering PrEP in Dreams Centers, which is a project that is also funded by PEPFAR that is aiming to reduce HIV infections amongst adolescent girls and young women, and basically make sure that they grow up to be strong, resilient women. And so for this age group, we do have PrEP services that are offered in the community. We also have a number of cooperating partners that provide PrEP also in community-based settings across the country. So you can access PrEP in these community-based settings, but we do advise that for your first interaction, you do present at a health facility, and again, talk to a healthcare provider that will help walk you through the eligibility criteria and allow you to come to an informed decision as to whether you want to start taking PrEP. After that, after you are initiated on PrEP and you are taking PrEP, you will have options on collecting your PrEP drugs from a community-based center if perhaps going to a clinic is too far for you or too cumbersome for you. So there are a variety of locations in the country where we are offering PrEP outside of government clinics. So while perhaps Michelle is experiencing some technical difficulties, I did jot down some of the questions that have come through already. One question, forgive me, I didn't catch the name, was what is the purpose of using a condom if you are still taking PrEP? And so the reason why we still advise that you use a condom. So yes, Kelvin, thank you for your question. Kelvin asks, so what's the purpose of wearing a condom when you're taking PrEP? Hi, all. Apologies, technical difficulties. We're back.
Yeah.
So yes, sorry, Michelle. When we lost you, I was answering Kelvin's question on what is the purpose of wearing a condom if you're taking PrEP. So I was just going over again what PrEP does and what PrEP doesn't do, and was stating that, for example, if you are a young man and you have a girlfriend who is not taking any sort of contraception, PrEP will not prevent pregnancy. So if you do not wish to have a pregnancy at that moment, it is advised that you either wear a condom or ensure that you are using a contraceptive of your choice, whether it's the implant, oral contraception, or condoms. PrEP will also not prevent other sexually transmitted diseases such as syphilis, gonorrhea, or chlamydia. So you need to ensure that if you are sexually active with a partner and you do not know whether or not they have any of these sexually transmitted infections, you do use a condom to prevent yourself from getting one of these infections. Yes, I'll stop there.
Okay, thank you so much for that, Nsonda. We also got another comment from Mark, who asked, at what age can one have access to PrEP?
Thanks for that question, Mark. So the age of consent in Zambia is 16. So in order for someone to go to, a government clinic, et cetera, and get have access to HIV prevention and treatment services, they have to be 16 and older. So if you are 16 and older, you can walk into a facility and you will get provided with the service. If you are younger than 16, but you are an emancipated adult, so we still have a lot of, situations where people are younger than 16 but are married, or people are younger than 16 and have children. So those are considered emancipated adults, and they can go into a facility and get access to PrEP services.
Okay, thank you. So Constance Makumba says more sensitization is needed among young ones on PrEP. Some don't have information on this, and it can be done in schools or at a community level. Thank you, Constance, for that comment. Msonda, I'm not sure if you answered this question from Emmanuel, because I did get kicked out at some point, but Emmanuel was asking if it is safe for him to take PrEP if he has syphilis, or hepatitis. If someone has hepatitis, is it safe for them to take PrEP?
Yes, there are no contraindications with PrEP drugs and those drugs that one would take for hepatitis. But again, we do advise that you go into a health facility and really have this one-on-one engagement with a healthcare professional that will, again, allow you to reach the decision as to whether PrEP. I know webinars from now, we will have a wonderful doctor, Dr. Mundia, who will come on and can answer more questions from her medical background. Again, I'm not a doctor, so I'm not best placed to advise you, but we do encourage you to go into a facility and have this one-on-one engagement with a medical professional.
Okay, thank you. So what is epidemic control, and what role does PrEP play in Zambia in achieving epidemic control?
Thank you for that question. So basically, so in the context of HIV/AIDS and the pandemic, epidemic control is reached when the total number of new infections falls below the total number of deaths amongst all HIV positive individuals. So of all the countries where PEPFAR, which is the President's Emergency Plan for AIDS Relief, is implementing, is supporting, local either departments of health or Ministry of Health to implement HIV services, we're all measured against how far we are in this journey towards achieving epidemic control. Zambia is not there yet, but we have made notable progress in towards controlling the HIV epidemic in the country. What we are seeing is less people, dying from HIV/AIDS opportunistic infections. We are seeing reduced numbers of infections in the country. In fact, since 2010, there's been a 50% reduction in new HIV infections. So as a country, we are making a lot of progress, but we still have a ways to go, which is why interventions like PrEP really play a role, because they will allow people to avert HIV infection.
Okay, perfect. So Stephen Chikwa is asking if PrEP is accessible to anyone who needs it.
Thanks for that question, Stephen. Yes, PrEP is accessible to anyone and everyone who needs it. Again, if you feel that you are at higher risk of contracting HIV for whatever reason, you can visit your nearest facility. Again, you can dial from any phone, *573#, and it will give you a menu of options that you can use to select the closest facility to you. So you can go in, this is available at more than 1,300 clinics, and have a conversation with a provider, and you can start PrEP today if you choose to do so.
Okay, an interesting question here from Ella Petronella, who's asking if PrEP is an ARV.
So PrEP is an antiretroviral. Currently, what we are using in Zambia for PrEP is a drug called Truvada. So what we provide for antiretroviral therapy is a combination of drugs to treat HIV infection in somebody that is living with HIV. So in Zambia, the drug we are using, I will not say the whole thing, but it's basically called TLD. It's a new, very efficacious regimen that is a lot easier to stomach, more it helps people who are living with HIV achieve viral suppression much quicker. And viral suppression is when the number of copies basically in your blood of HIV are less than 1,000. So this is why we say that HIV is no longer a death sentence. We're not seeing those days anymore where people are emaciated and coming to the clinics in wheelbarrows. That is not the case anymore. You indeed cannot tell by looking, because these new efficacious drugs allow people to live completely long and healthy lives. So it is part of an HIV or ARV regimen, but what we really try to emphasize is you should not let that stigmatize you or use that to stigmatize others if somebody is taking PrEP. This is something that they can take to ensure that they protect themselves and keep themselves from contracting HIV.
All right, perfect. So we have another question, which reads, what could be the possible side effects of using PrEP?
So again, Dr. Mundia will be on in a couple of weeks, and she can go more in depth in this. But I can just touch on it a little bit. What we do see in clients that begin PrEP initially, and it lasts about 2 weeks. It could be some stomach issues. We do see some people say that their appetite increased. Other people say that their appetite decreased. So, these are some of the minor side effects that somebody can have in the first 2 weeks of taking PrEP. But what we also see from a lot of our clients is no side effects at all. They start taking PrEP and they do not complain of having anything, with stomach issues or decreased appetite or increased appetite. So if you do have side effects, they're very minimal and do pass within 2 weeks.
All right. So we have a comment from Darius Walia Chama, who says, someone from the community complained to me that PrEP is not convenient, as the days of taking it before intercourse are many, especially for ladies, as a recommendation so that more people come on board. There is need to develop a drug with fewer days to take prior to the time that someone can have sexual intercourse. Do you have a comment on that, Ms. Sanda?
Yes, I do. So I think what Darius is referring to, and thank you for that comment, is something that is sort of coming online now, which is called event-driven PrEP. So this is something that can be taken, when you do foresee an event that is coming up that could put you at higher risk. But we are still very, very, very far from this being something that is incorporated into our day-to-day implementation. And so for pre-exposure prophylaxis, which is the oral pill that you take every day, for it to become effective in your blood, for women, it has to be taken for a minimum of 21 days. And for men, it has to be taken for a minimum of 7 days. I know it's not fair. Why is it quicker for men than it is for women? It's just the way that our bodies are basically the way that our bodies operate. So we do not encourage you, do not start taking PrEP on Monday and think that as a young woman on Thursday, you can have unprotected sex and you will be protected from contracting HIV. As a young woman or as a woman, if you take PrEP, it'll take at least 21 days for it to become effective in preventing HIV. And if you are a male, it will take a minimum of 7 days.
Okay, thank you for that. So we have another question here from Stephen, who says, given what you just said regarding epidemic control, how many cases have been prevented, particularly by the use of PrEP? And what are the current targets around prevention by PrEP?
Stephen Chikwa, I'm starting to wonder if you are in the field of health. Thank you for that question. So, it's a difficult question to answer, because I wish I could say that I can pull data for you and say in the last 12 months or 24 months, we have prevented this many cases of HIV, and I'm for sure of this. But what I can tell you is that, since 2010, we've seen a 50% reduction in new infections. And what is at least evident, we had a time where in Zambia, we were seeing at least 69,000 new infections every year. So 69,000 people every year, at least, were beginning to were being infected with HIV. We have new data coming out soon from a population study that's been conducted in Zambia about a year ago, that is showing that we had about 49,000 new HIV infections. It's still a lot. To me, I think that's still too many. But if you look at coming from 69,000 to 49,000, we are making a lot of gain. And this is because of interventions like pre-exposure prophylaxis. It's also because a lot of young men are opting to get circumcised. And we know that for young men who are circumcised, they reduce their chances of contracting HIV by 65%. We're also seeing more prevention of HIV transmission from mothers to their babies. So it's all of these interventions together that are helping Zambia in this journey to achieving epidemic control.
Thanks for that, Swanda. We have a question from Veronica Tumelo, who's asking, so she says she's been having hiccups with the network and doesn't know if this question has already been answered, but how long and how often is PrEP supposed to be taken?
Thanks, Veronica. And I don't mind repeating this at all, because I think it's something that's really quite important for people to get. So a lot of the times we have clients that come in and say, I have a plan or I have a date this weekend and I want to start taking PrEP, So I wish it worked like that. But currently with our oral PrEP, it does not work like that. So if you are a young woman, or if you are a woman and you feel that PrEP is right for you, you start taking PrEP, and it'll take at least 21 days for your body to be protected from HIV. And you will have to take PrEP every day. So you will choose a time that is, suited to you, and you will take PrEP every day for as long as you feel that you are at risk. If you are a man, it'll take at least 7 days for your body to be protected. And again, you take it every day. And PrEP is something that you take for as long as you are at risk. If, for some reason or another, you feel that you're no longer at risk, you can stop taking PrEP. But then if you, 2 months down the line feel, okay, I'm engaging in some more riskier behaviors, you can start taking PrEP again. So it is something that really is suited to different individuals depending on what their lifestyle is. So I'm not sure if Michelle is having connectivity issues, but I see a question from Donovan, which has made me chuckle a little bit, that says, so can't we stop using condoms since there is PrEP? So no, you can not stop using condoms since there is PrEP. So what PrEP will do is it will prevent you, if taken correctly and consistently, it will help you avert being infected by HIV, but it will not prevent pregnancy. So if you are a young man with a female sexual partner that is not on contraception, whether it's oral contraception or an injectable contraception or an implant, if your partner is not on contraception, your partner can get pregnant. And if also what PrEP does not do is prevent other STIs, sexually transmitted infections, like gonorrhea, chlamydia, or syphilis. So PrEP does not mean no more condoms. It's still, you should still, as much as possible, ensure that you use condoms if you don't know whether or not your sexual partner has STIs.
Okay. I don't know if you're able to hear me now, Musonda.
I can hear you.
Okay, perfect. So we have another question from Chabu, who's asking if there are any complications that may come as a result of taking PrEP in line with, in line of the medications being strong despite being used for prevention.
So I wish Dr. Mundia was here because I would have putted this question to her. But what I can just touch on it briefly is, you know, and I'm not too sure on the, you know, how frequently this happens, but we can see potentially some drug resistance in some clients that are taking PrEP if for some reason they do seroconvert and become infected with HIV. So, you know, because PrEP and the drug we use in country is Truvada, is something that is part of a drug regimen for ARVs. There are some clients that do develop resistance while taking PrEP when they do, for some reason or another, become infected with HIV. It doesn't happen a lot. And again, I think Dr. Mundia is going to be really well placed to answer this question more clearly. But in terms of sort of other things that can happen to you when you're taking PrEP, there are very few incidents of anything that can end up, you know, happening to your body because you are taking this drug to prevent HIV. And just to emphasize, I think I mentioned this before, the new regimens now that we are using are not as harsh on the bodies as we saw with the initial regimens that were being used to treat HIV. So it's something that is completely is less harsh on the body, more efficacious, and takes less time to be effective in the body. So do not worry about like developing some funny, you know, disease or anything like that, or something severe happening to your body because you are taking PrEP.
Okay, perfect. Thanks for that explanation, Sonda. Sylvester wants to find out if you can take PrEP during pregnancy.
Yes, Siba. So you can take PrEP during pregnancy. You can take PrEP when you are pregnant and even when you are breastfeeding. It will have no effects on your baby, whether your baby is in your stomach or your baby is getting milk. And in fact, I think it was Steven who had asked for some data about targets, etc. In the last financial year of our program implementation, we had about 20,000 women who were either pregnant or breastfeeding that took PrEP. And so they took PrEP because we have a lot of women who are pregnant or breastfeeding seroconverting. So for, at some point in their journey of pregnancy and breastfeeding, a lot of women in Zambia unfortunately become infected with HIV. And so, we have these engagements with or interactions with pregnant or breastfeeding women. And if they feel that for any reason or another, they are at higher risk of contracting HIV, they can start PrEP. And PrEP will prevent them from getting HIV, and it'll also help them protect their baby from HIV infection. So if you're pregnant or breastfeeding, if you're going to MCH or antenatal, you can ask your provider about PrEP, and you can, he or she will go through the options with you, and you can, decide to start taking PrEP if you feel that you are at higher risk.
Okay, perfect. So we have another interesting question here from Noria Mbasela, who's asking if PrEP can be shared with another person. If they do, how can it affect them? So shared, I'm guessing in terms of the doses or
Yeah. No, PrEP should not be shared with another person. If you go and you get a bottle of PrEP for yourself, that is for you. If you feel that if you have a friend of yours or a colleague or a sibling or whatever that says, you're taking PrEP, I also wanted, can I take PrEP as well? What we would advise is for you to also tell that person that they should go to a health facility and get their own PrEP drugs. And this is mostly because, and perhaps I will just repeat this point again, it takes at least 21 days for PrEP to be effective in a woman and at least 7 days in a man. So, if you have a pill pack that has 30 tablets and you're sharing it with 5 people, it's going to affect your, it becoming efficacious for you. So do not share your tablets. It's better you keep yours for you, and you can advise the person to go to their nearest clinic and they can get their own supply of PrEP.
Right. Thank you so much. So another question that I kind of found intriguing was why do you think we have so many new HIV infections among adolescents and young people, especially? If we have things like PrEP, for example, that are meant to sort of help curb the situation, what do you think is causing the high rate in terms of like new HIV infections?
Thanks for that question, Michelle. I think it's a really important question. And, there are a variety of reasons why we're still seeing so many high infections amongst adolescent girls, adolescents and young people. So I mentioned, some minutes ago that we've seen a 50% reduction in the number of new infections in Zambia since 2010. But even though there's been this really, significant decrease of those new infections, 40%, 40 are amongst adolescents and young people. And this is scary, And so why do we see these high risks of infection? We were young, both of us. I think we can still say we're young, but we were younger. And I remember feeling like I was untouchable. You feel that you are invincible, and there is less risk perception amongst adolescents and young people. So you can find that, as a young woman, I might be 19. I have a boyfriend who I love and I'm in a relationship with, but I also might have an older man who maybe gives me money for a phone or makeup, etc. And perhaps I'm not using condoms with both of them. So that puts me at higher risk. But even though I'm doing that, I don't necessarily think it's something that is risky, So, multiple concurrent partnerships, low condom use. And also, it's one of those things where I mentioned before that HIV is no longer a death sentence. So I think that fear that people used to have of HIV is not there anymore, which is a good thing, because I think all of us have, a father, a mother, a sibling, a cousin, a friend who we know potentially is living with HIV, and they are living a full and healthy life. And you can't even tell by looking at them that they are living with HIV. That is a good thing, because we now have these regimens, ARV regimens, that allow people to live healthy lives. But because we're not seeing those massive funerals that we used to have anymore, people being, emaciated and skinny, people think, well, even if I do get HIV, it's fine, I'll take drugs. Which is, yes, you'll take drugs, but isn't it better to prevent yourself from getting HIV? It's like with COVID. You get COVID, and yes, you can be treated for it, but we still make sure that we have all of these precautions that we take on to prevent from catching COVID. We wash our hands, we sanitize surfaces, we wear face masks. And so that's what PrEP is for. Yes, if you get infected with HIV, you will be linked to ART and start ART and live a healthy life if you take your drugs correctly and consistently. But you can prevent yourself from getting HIV. So it's really important for us to engage with young people like we're doing on this forum, and tell them that there is this HIV prevention method that they can take. They can access information on, I'm wearing a t-shirt that says Zambia Ending AIDS. There's a Zambia Ending AIDS Facebook page that they can go on and get information on PrEP. You can dial *573#, get information on PrEP. Go to your nearest government facility and get information on PrEP. So, just empower yourself with information that will allow you to make a choice on, that will enable you to stay healthy and live a long life.
Okay, thanks for that, Musonda. Bernard Kabila says, how available are they? Hospitals only, or even in pharmacies and drugstores? And does accessibility need guidance?
So I'm going to guess that by accessibility, you mean, is it something that you probably need, sort of that interaction with a healthcare provider? Yes, PrEP can only be provided to you by a trained clinician that is able to prescribe that drug. So it is currently available at all government, at least a minimum of about 1,300 government facilities in the country. These are hospitals, these are clinics, and these are even little health posts that we have in a lot of our communities. So we are currently working to engage the private sector to figure out how to make PrEP available in other outlets. We know that for some reason or another, people don't like going to clinics, especially men. For some reason, they prefer not to go to a clinic. So in order to reach these people that, for some reason or another, don't want to interface with the health facility, we are working with private sector entities to see as much as possible how to make it more accessible there. So right now, it is advised that you go to a clinic, a health facility, or a health post, and speak to a healthcare provider, and you can start PrEP if you decide that it's the best option for you.
Okay, thank you. Hansel Mutwa is asking if PrEP is advisable for persons who are on chemotherapy.
I will not even attempt to answer this question. I do not know, Hansel. So, but again, in about 3 weeks' time, we will have a medical doctor, Dr. Mundia, on the show. She is amazing. She has been really involved with the Zambia Ending AIDS campaign. And in fact, she has question and answer sessions on the Zambia Ending AIDS Facebook page occasionally. So she will be on the show in about 3 weeks. And all of you people who are on this session right now, if you are enjoying it, please do call in. And if you have more medical-based questions, she can answer those for you.
Okay. So another interesting comment from Stephen here, who says, now that you've mentioned about perception, I remember growing up, how the thought of contracting HIV prevented me from piercing my ears. The info was quite inadequate then. So each time I went to get pierced, I would run and yeah. So while the guy was preparing the gun, he would literally run away. Thank you for that comment, Stephen.
Yeah.
So Musonda, what would you say are some of the barriers that currently exist, especially for young people, adolescents, choosing to take PrEP as an HIV prevention method? What do you think could be some of the barriers?
There are a number of barriers. I mean, I think I'll start with, I think as young people, sorry, there's a helicopter flying over my house. As young people, a lot of the times, I mentioned this with men as well, but it's the same thing for, I think, especially young people. They don't necessarily feel a need to interface with a health facility. And so this is why, as much as possible, if they don't come to the facility to get the service, it's really critical to then take the service to them where they are found. Because what we've seen a lot of the times is when they do go to the facility, which is, unfortunate. I think it's because culturally, when you are a young person, you should not be thinking about sex. You should not be talking about sex. Don't even think about having sex. So I think a lot of young people think, if I go to the clinic, I'll see a nurse who is maybe old enough to be my mom or my auntie. How do I ask this person about condoms? How do I ask this person about PrEP? So those are some of the barriers that we're encountering with young people. So what we are doing in collaboration with the Ministry of Health, with implementing partners, is training our healthcare professionals to be youth friendly, not be judgmental. If somebody comes in and wants to have this conversation with you, if they get a negative interaction, that can send them away from the facility forever, So that first interaction is really critical in ensuring that somebody comes back. So being open, providing information, we're also empowering young people to actually be the ones providing the service, because I would rather talk to an age mate about something relating to sex or something awkward like that, as opposed to somebody who's old enough to be, my mother. So ensuring that young people are empowered to provide this information to their fellow young people, taking the services to where young people are found, so that, they don't have to worry about missing school and spending, 5 hours in the clinic queuing up for something, So really differentiating and, making something easier to access for somebody who needs it, So I think together with the Ministry of Health, we're really making a lot of progress in this. There's still some work to be done, but, one of the things that we also need to work on is the information. I can't remember, one of the members in the audience mentioned that this information is not available. We really need to work harder with pushing out this information so that young people know that there is PrEP out there. They can go and take it to prevent HIV. So, using social media, using more traditional social mobilization methods like going to marketplaces, communities, etc., figuring out how to work with the Ministry of Education and General Education to provide comprehensive information in schools that is appropriate, age appropriate, So I think with all of these things, put together, there's really a lot of good that can be done for the young people of this country.
Okay, perfect. Thank you. So Emmanuel Miranda wants to know if it is safe for people drinking alcohol while they take PrEP, and how effective is PrEP in such instances where they are actually taking alcohol.
Thanks, Emmanuel, for that. I won't go into contraindications because I think Dr. Mundia will do that better. But I think what I will say is, when if you drink alcohol a lot, it can impair your judgment. And I think that's one of the things that we'd really want you to be conscious about is, you know, maybe if you're drinking alcohol for the whole weekend, you might forget to take your PrEP drugs, you know, and if you get to take your PrEP drugs, then you're not taking it consistently and correctly. And you might then reduce your chances of preventing HIV. So I don't think it's an issue to have a couple of drinks while you're on PrEP, but we know, unfortunately, in this country, people don't stop at a couple of drinks. So, you know, just remember that alcohol sometimes can impair your judgment and also therefore affect the decisions that you make. So I think it's just important to keep that in mind if you are, you know, really trying to keep yourself from being HIV infected.
Okay, thank you so much. And thank you to everyone who's sending in their comments, their questions, and, you know, just applauding our speaker today, who's really given us a lot of information that will be helpful to each and every one of us. Unfortunately, time is never on our side. So I will ask that we wrap up. So Msonda, any last words, any words of encouragement that you would like to pass on to those that are listening, those that are watching? And also, as you wrap up, you can also just tell us a bit more about what PEPFAR is doing to just reach out to some of the young people specifically to provide HIV prevention services.
Thank you, Michelle. Thank you for having me on here and allowing me to talk a lot about something that I love talking about. I think just to wrap up, you know, as I feel proud of the work that I do. I mean, I'm happy that I work for PEPFAR and USAID and the work that we do to really focus on community-led approaches that, again, will take services to where people are found and provide this potentially life-saving, you know, intervention to people in Zambia. We are a young country, like 50% of people in this country are younger than 18, I think, you know, and so you know, it's corny when people say, "Oh, young people are the future." You know, we are the future, but we are the future. Well, I'm no longer a youth, but you know, they are the future. So I love being part of, you know, a process that seeks to empower young people with information that will allow them to, you know, make decisions that will enable them to prevent HIV infection, to choose when to have children, to prevent STIs, you know? And so it all begins with us, you know, Stephen, Veronica, all you people that were on this call today, if you come across somebody that, Emmanuel, thank you for your great questions. If you come across someone that is engaging in risky sexual behavior, you know, you can say, "Hey, I heard about something called PrEP. Maybe we can go and check it out, or you can go and check it out." You know, it's up to us to really make sure that we take the steps necessary to keep ourselves healthy and to be able to live a productive life that will allow us to be the future of this country. So thank you so much for allowing me to participate in this and the great questions that came through. Thank you for our marvelous host, Michelle. And I hope everyone has a great weekend.
Thank you so much, Msonda. So I was joined by Msonda, who is PEPFAR Interagency member as well as USAID Community Art Advisor. We have come to the end of the show, unfortunately, but special thanks to the Zambian Youth Platform for putting this show together with the amazing support of PEPFAR as well as Chaz. So thank you. Until next time, my name is Michelle. Have a good afternoon, good evening, good morning. Happy weekend.
Bye, all.
Bye.